One of the great problems we have in trying to do clinical trials with patients to find out better treatments for our patients and to lessen the cost of healthcare is to be able to know that when a physician gives a patient instructions, that the patient actually carries those out and does them well and gives us some measure of the change that we're inducing from those instructions. I don't have any way to know when the person goes home whether they're really doing what we ask them to do or how well they're doing it, how often they're doing it. To help solve this, engineers at UCLA have come up with some really interesting uses of devices that are virtually off the shelf. These are small accelerometers that tell about movement in different directions, microgyroscopes that tell about rotations, GPS systems that tell where you are, and other small devices that can measure heart rate and blood pressure. And they're able to integrate this information. What can I do with this information? Well, I can attach small sensors to the arms or legs and get information about how much I use my arm, how much I practice reaching in particular ways, how fast I do that, how accurately I do that. We've never had an opportunity to have this information inexpensively available, and certainly not outside of a sophisticated laboratory setting. What's the key thing about these sensors? It's the rather brilliant algorithms, mathematical algorithms, that the engineers and computer scientists have come up with to be able to take these little accelerations and movements in different directions and have them recognizable as purposeful movements that might involve reaching or brushing your teeth or combing your hair or standing up or climbing steps or walking on different surfaces. Now we can see how fast, how well, how often people are doing these things. And all this data is simply downloaded into a computer off a little USB port wirelessly, immediately describes the various activities, how much was done, and over time, in collaboration with many other researchers, we'll be able to look at the quality of that movement. We will now have wonderful outcome measures for our clinical trials, and hopefully we'll be able to compare one treatment to another much more effectively.